Hello, I'm James Sanderson, Director of Personalised Care for the NHS in England. I'm delighted to be speaking at the launch of the Personalised Care Institute. Personalised care for me means giving people choice and control over the way their care is planned and delivered, based on what matters to them and, importantly, building on the assets that they bring to their own care.
Continuity of care and personalised care are core to UK general practice, valued by patients and vital to a thriving NHS. This is why we support the Personalised Care Institute and the Personalised Care Curriculum, and why I look forward to a long and fruitful collaboration.
At its heart, personalisation means professionals working with people as whole human beings, in context and as partners in support, care and treatment in the pursuit of their well-being and self-determination. It means respecting choices and bringing together professional knowledge and skills with the wishes, wisdom and self-knowledge that we all bring to health or care conversations.
Choice and control is at the centre of everything we need to do. And if we can have a shared understanding between health and social care about that, with commissioners of social care, employers in social care, people with lived experience, all being able to contribute to that vision, we can only improve the quality of lives for everyone.
The benefits of personalised care, especially in the mental health field, are far-reaching and really wide. I think it's really important that people who have got mental health issues or who aren't feeling so good at any particular time know that with personalised care it's going to be tailored to meet all their needs.
At Macmillan Cancer Support, we want to ensure that everyone receives this truly personalised care. And so we are really looking forward to working closely with the Personalised Care Institute to help shift the approach to care from asking, what is the matter with you, to what matters to you.
I think that personalised care helps health and well-being for all of us involved. As a pharmacist having conversations about medicines, I think it's really important to understand what really matters to somebody about their medicines and their health, and it quite often isn't the same as what we think.
I think personalised care is about giving people choice and control over their health and well-being, and therefore we need to empower general practice in order to empower the general population to take control of their health and well-being.
Where personalised care is implemented, there is a huge benefit to both staff working in that model and the families receiving that care.
It's fantastic to be part of the launch of the Personalised Care Institute. What does personalised care mean to me? Well, it's unashamedly about performance. From a patient perspective, we know patients do so much better if they're in control and feel ownership of their situation. And from a staff perspective, when they're enjoying their work and they're inspired by it, they do so much better as well.
I've been interested in personalised care for the last few years. In fact, it started during my training, where as a professional, I felt this responsibility to make decisions that are centred on patients' values and preferences. I think each of us are different in what we value, and it's really important to elicit that through our consultations and through our interactions with patients.
I'm really confident that the skills and development that come through the Personalised Care Institute will help us to build some new relationships and think about that balance of power. I think it's also about building new solutions, so actually thinking about what outcomes really matter for patients and users of services. Is it all about that number that measures your blood sugar, or is it actually your ability to do something like make a cake with your granddaughter?
Our personal hope is that the Personalised Care Institute can support understanding between social workers and health colleagues, add to interdisciplinary learning and mutual respect and appreciation, and ultimately to ensure services and people's experiences of social work and healthcare are much better integrated around their needs, their wishes and their rights.
So the Personalised Care Institute, it's going to baseline the training and the knowledge and capabilities that people need in order to have those conversations. And we need to make sure that it's actually evidence-based to be able to actually have the conversation with the person, making sure that we're actually empowering them, increasing their knowledge, skills and confidence to be able to carry out their roles.
So it's really liberating. I no longer feel the responsibility of needing to make sure people adhere to their medicines. It's a different kind of conversation where you can support them with their choices and be alongside them in that. I've kind of realised that people make choices about whether they take medicines every day, sometimes several times a day. And so actually the choice is already with them. It's just that a personalised care approach helps them to have a different kind of conversation and perhaps to meet their needs more.
The barriers are not as great as we thought, and staff are very able to work in that personalised way, delivering care across specialties and for the benefit of those families and their newborn baby.
I think that by delivering training to a large number of staff at a very high level of quality, we'll be able to move forward on this agenda and start delivering the care that patients and users of services have been asking for some time.
Personalised care provides a real opportunity for the country to develop health and care systems. And that's why it's great that we've joined together today with a number of partners to bring the Personalised Care Institute to life.
I would suggest that having a personalised style conversation will improve our own health and well-being. So everybody wins. So it's great that the Personalised Care Institute has been established to support us to develop the skills through training about how to have these different style of conversations with people. So thank you.
This new institute will bring together the evidence, it will set standards and help training by setting a curriculum for the future of personalised care. It's been a lot of hard work for a lot of people, and I want to thank you all for what you have done to get us to this point. And I really look forward to working with all of you in the coming months and years to make the personalisation of care the heart and soul of the way we practice medicine.